Everywhere I've gone, I've been welcomed with open arms, and that's what I like about Fresno. We're a really nice city. We really are. I mean, you go to the grocery store, people say hello to you. What I like about Fresno is it has big city stuff and it's still a small town feel. We just got to get away from the small town thinking and start thinking more progressively. That's all.
Addie Carr works in the Tower District of Fresno, an area which is home to some of Fresno's most active residents, including a presence of an ever-growing homeless community.
Lots of different layers of homelessness. You have folks who are chronically homeless, that have been on the streets for years, and might struggle with a mental health issue or a substance abuse issue. You also have folks that are couch surfing, so they're bouncing from place to place, which is, I would say, fairly common with youth homelessness, and even adult, older adult homelessness. And then you have whole families that are homeless, right, due to various issues, domestic violence issues.
In the Tower District, all walks of life are supported and even helped by the neighboring businesses in the area. Yet many of the homeless population continues to get 5150'd with a lack of access to mental health resources. This leads many individuals down the path of self-medication.
The mental health is one of the major factors in substance abuse. And a lot of times that's combined, right? Folks are self-medicating and have had long-term mental health disorders, and I would say severe mental health disorders. And a number of our folks that come into the store also have a diagnosis, and they're not necessarily taking the medication because it's hard to keep track of medications, or medications are stolen. They're bouncing from place to place, and so there's a lot of barriers in terms of them even maintaining their mental health if they actually have a diagnosis.
Though community members acknowledge what homeless individuals deal with on a daily basis, the homeless population are still the first to deal with the effects of public policy. In fact, this year the STOP Act was proposed to the City Council to make it illegal for individuals in cars to give money or food to a homeless individual at an intersection. Community members protested against this, and the ordinance failed to pass. In 2017, however, Fresno City Council voted 6-1 in favor of the Unhealthy and Hazardous Camping Act. This ordinance made camping in public and private properties illegal. Those that violate the act could face a $1,000 fine, up to 6 months in jail, or be relocated to a MAP Point program. One organization that works closely with the MAP Point initiative is the Poverello House, which has been a strong resource for Fresno's homeless community.
Multi-agency access point, and that program is to link people directly to the resources they need, like medical care, mental health services, and housing. And that's also funded by Department of Behavioral Health, and we work in collaboration with Kingsview and Central La Familia. That program alone can see up to 90 people per day.
Sarah Merhadi, the Chief Program Officer of the Poverello House, also had the chance to touch on other resources that their organization has to offer.
So our goal here is to provide services to everybody regardless of their circumstances. So we're kind of like a no questions asked facility. So not only do we have our homeless programs here, but we also have our men's residential rehab program, which is 6 months to 1 year. That is a completely free program. And we also have a vibrant aftercare program.
Much of these services are provided on the camp. This includes meals and temporary housing. Outreach is also done by sending food trucks to rural areas in Fresno, as well as keeping in contact with other organizations due to a strong need of differing services.
Because right now there is a shortage of family shelters in Fresno. And also there is a shortage of shelters that takes all types of families, including fathers as heads of households and things like that. So we want to make sure that we, provide those types of services for those families wishing to stay intact, even if they don't fit the traditional family mold. We actually work with a lot of different organizations. I always say Poverello House is not one agency can't resolve the homeless issue. We have some of the answers, but not all of the answers. So as a result, we work for many fine organizations like Turning Point, WestCare, the Housing Authority, EOC, Kingsview, Central La Familia also work with Fresno County Department of Social Services and Fresno County Department of Behavior Health on a regular basis.
You have tons of just individuals who actually do care about people, especially in this area, the Tower area, that will encourage people to seek treatment or go into rehabilitation programs or just walk alongside.
We're all dedicated into helping people. And these agencies need to be, acknowledged, and they need to give encouragement because sometimes they hear a lot of negative stuff in the press, but they're really doing a lot of good work and doing some damage in a good way. It's just a huge problem.
And it's a problem Fresnans haven't shied away from. Rather than turning their backs, Fresnans have turned to each other to promote and work with organizations that support lower-income communities. Fresno's not a perfect city, but it's a city that many call home. A home for rich, poor, black and white. Fresno's a city filled with individuals and groups that strive to create a better home for all.
There's different folks in different levels, right? So you have Evangel Home, you have the Marjorie Mason Center, right? You've got Poverello House and the Rescue Mission, and there's another program called a program under New Outlook. You have West Care that's helping with substance abuse. You have CAPS, you have Turning Point, and then you have an organization like Living in Fresno that's working with folks that are in the motels, which the federal government wouldn't necessarily define as homeless, but I personally would define as at risk for homelessness for families that are bouncing in and out of the motels in our city. And so you have, quite a few organizations